Hi, my name is Lauren Follensby, and I'm an occupational therapy student at Rush University, and I'm finishing up my last couple weeks of my Level 2 fieldwork at Schwab Rehabilitation Hospital through a series of telehealth sessions focused on pediatric occupational therapy. This session will be focused around body awareness and safety, and all of the activities mentioned in this presentation will be activities that you can do at home with your child, despite the stay-at-home order around the COVID-19 public health emergency. Are you concerned with your child's safety awareness? For example, does your child have difficulty holding your hand to cross the street? Know when it's safe to cross the street or look for cars? Does your child run away from you when you're at the store, running errands, or waiting in line? The following exercises may be helpful to attempt and practice at home to increase your child's ability to follow directions, plan his or her body movements, stop his or her body movements, and overall improve your child's safety at home, school, or in the community. Deep pressure and heavy work provides what occupational therapists call proprioceptive input into our bodies. Proprioception is your body's awareness and sense of position in space. Proprioceptive input is provided when there is deep pressure to the muscles and joints of our bodies. Given this, every child has a unique nervous system or way their brain and body interprets the environmental information around them. For example, if your child loves to run around, lift heavy objects, crash into furniture, or you find them frequently tripping on objects and demonstrating some clumsy behaviors, this might mean that your child has a high need for proprioceptive input or deep pressure and heavy work to become calm and focused. Deep pressure and heavy work also provides that input for your child to become more aware of where their arms and legs are in space, building body awareness, increasing attention because it helps modulate them and also helps regulate emotions in turn. So just some deep pressure and heavy work activities that I brainstormed that you can just easily recreate at home are playing basketball. So when the child grabs the basketball, they can feel the deep pressure and the pressure on their muscles when they're in the small muscles of their hands when they're dribbling the basketball, even feeling the weight of the ball while they're trying to shoot it into the hoop. Building an obstacle course throughout your home, so making use of different cushions, pillows to crawl across, putting chairs to climb over. As long as it's safe, you can be creative with the obstacle course. Maybe even putting cones into the obstacle course, dribbling a ball around the obstacle course, including hopscotch, incorporating a trampoline, jump rope, things like that. One other thing that at the clinic all the kids really love to do, and it was a great way to kind of activate those mirror neurons, getting them more able to copy a picture or a person doing a different pose, is yoga. So one company that we use that had really great kind of pediatric focused pictures is called Gorilla Yoga. So this is something that you can look up online or on Amazon and purchase those yoga cards for home. But also just copying the yoga movements is a really good way to work those muscles, get that core strength, and warm up a lot of their arm and leg muscles. Some other deep pressure and heavy work regulation strategies. So these are strategies that you can bring wherever. You can do these strategies at home. A couple of these you can do in the store. It's just ways that you can give that proprioceptive input to the child when it's needed most. So a couple ideas that I brainstormed were like wrapping a child in a blanket. In the clinic, we would call this like wrapping them up in a taco or a burrito, and kids love that. Also, like giving them squishes with pillows. If you have a beanbag at home, kids love to jump in the beanbag. You can fold up the sides of the beanbag and give them a big squish. Something that you can do anywhere is like just hold your child, giving them that comfort and security, or giving them hugs. You can even do that as like a reward. A couple things that have a limited amount of evidence, but in the clinic we saw through observation that they worked very effectively, and based on like parent subjective or report, that they worked really well. It can really help with seated attention too. So this would be the compression vest and the weighted vest. So the compression vest is like a lycra-based material. It's super stretchy. It fits very snug to the child's body, and it really just gives that deep pressure input to their muscles. And then the weighted vest is pretty similar, but it's weighted, so it slows the child down a little bit more, and it provides that heavy pressure through weight rather than through stretchy material. And then the weighted blankets are also something that are pretty trendy. There's like some evidence that it may help with anxiety, that proprioceptive input. So both the weighted blanket and the vest, it's recommended that they are 10% or less of the child's body weight. So just keep that in mind if you are thinking about purchasing either of them. And the recommended compression vest brand would be the Spio compression vest. And this, you can talk to your occupational therapist about purchasing this through insurance and a doctor's referral. Then this picture on the right is just an example of what a compression vest would look like on a child. So this crossing the street social story is something that I've used with a lot of the kids in the clinic. I really love this social story because it has like awesome video and audio, and sometimes that just helps with getting the kid engaged quite a bit. They feel like they're watching a movie. So it's really fun. Gets them engaged. It gets them thinking about their next few steps for completing the activity. So for example, the learning to cross the street video like breaks down all the steps. It breaks down like looking at the crosswalk sign to know when it's safe, looking left and right to make sure that the road is clear, the purpose of the crosswalk, what to do when the light is red, what to do when the light is green. Breaks down all those steps, and it really helps the child visualize and process what to do and how to be safe. So that's why I really like this video, and this is something that you can do as like a warm-up to prepare the kid for crossing the street, for like practicing role play, which we will do in the next slide. This video is targeted for a little bit more of a younger population, so probably around age 3 to 4. It could maybe even be used for some 5-year-olds. Again, it's fun, engaging, and encouraging. And the YouTube link is in orange right here. So then for the stop and go game, the stop and go game is designed for approximately like 3 to 7 years old. It teaches self-control and among like many other things. So it works on self-regulation, attention, working memory, and impulse controls. So you can easily recreate this activity at home. You can either grab like a red and green plastic cone to simulate the lights, or you can print out a stop and go sheet online. And if you print off that sheet online, just make sure you like cut that sheet in half and paste the red stop sign to the green stop sign back to back so you can flip it around. So then every time you encounter a different room, pretend that that is like an intersection and that you're about to cross the road. So then when you get to the room, look left. You can even prompt the child, do you see any cars, any people? Is it safe? Is it clear? look to the right, any cars, any people, look back to the left. Okay, wait for me to flip this line and flip it to green, go, and do that with every single room in your house, pretending that that's an intersection. You can even go back through your house several times to do this. So applying what was learned from the social story video is what this teaches. So it's the application piece. There's also a good amount of evidence that the stop and go self-regulation game works. Tammany and McClellan in 2011 researched different types of games like this that work on self-regulation. And they found that if you do activities like this with kids, 30 minutes per week for about 8 weeks, there was a significant improvement in self-regulation. So this works. Positive reinforcement is a really great way to process this information, let the child know that they're doing well, and of course, like reinforce what they've learned. So positive reinforcement has a good amount of evidence. It's kind of inspired, you can like inspire it by positive psychology as well, that has an overwhelming amount of evidence for increasing child's growth and development. It promotes self-esteem. It's very effective. So it has a lot of evidence, and it's a good relationship builder between parent and child. So positive reinforcement, such as like praising a child, pointing out strengths, like, hey, you did a really awesome job on that activity. I'm so glad you're like trying to be safe. Hopefully we can practice this next time we cross the street. Giving them hugs, giving them stickers, or some other type of reward or incentive. So an example of this would be, hey, you spent 5 or 10 minutes doing my activity. Now you can have 2 minutes of your own free time. You can take 2 minutes to play with the dolls, or take 2 minutes to play with the Legos. Or if it's a kid who really loves movement, do 10 jumps on the trampoline, take a mental and physical break, and then we can try it again. Then research by Clark and Frick also proves that positive reinforcement and positive psychology is a relationship builder. So when parents use positive reinforcement, or they were warm and responsive versus negative reinforcement, or they were harsh and inconsistent for their children with callous or unemotional traits, it was related to a decrease in conduct problems. So their behavior got better with positive reinforcement, highlighting the importance of using positive parenting techniques. Research by Shoshani and Sloan in 2017, they used 315 participants, or kids, ages 3 to 6.5 years old, and they were randomly assigned to a treatment group of either a waitlist control group or a treatment group. So the waitlist control group means that they didn't receive any treatment, and they compared the two. And the children in the treatment group completed 8 modules of basic positive psychology concepts, and results show that this positive reinforcement is related to increased perceptions of the child's well-being and behaviors from both the parent's perspective and the teacher's perspective. So mentioned here are the references and my resources, all the different studies that I mentioned throughout the activities. And there is this one other link that I found that was very evidence-based, and there are also activities that you can simulate during this at-home order. And they all come from the Tammany and McClellan study. And they all target self-regulation, body awareness, stopping your body, motor planning, things like that. And these activities go up to like children that are 10 years old. So here's the link in orange right here. And thank you so much for listening to my video and some interventions. I hope they help you at home while you're doing this at-home order. Thanks.